My name is Dr. Hamilton, and I'm here today with Dr. Chang to actually go over abdominal bracing. The reason abdominal bracing is so important is because currently we're seeing that back pain is endemic here in America. We see millions and millions of people who are suffering from this, and a lot of times they suffer from it for a very long period of time because they have not found the correct cure or the correct treatment for their back pain. Anytime we take a look at back pain or back pain issues, we have to look towards stabilization of the core. Because if you don't have a stable core, what will end up happening is structure can come out of alignment, or you can even see certain muscles go into spasm because they're having to work harder due to the inability of the core to strengthen that area. So the reason we take a look at the core is specifically because we have the larger upper body, which is actually stabilized by the rib cage, connected to the larger lower body, stabilized by the pelvis, by 5 lumbar vertebrae. The only thing we have stabilizing those 5 lumbar vertebrae is going to end up being the core musculature. The most important muscle in the core musculature comes down to the transverse abdominis. Now this is actually a muscle that goes in a transverse fashion right across the abdomen that functions similar to a belt. A lot of people when they think about core exercises think of the rectus abdominis. That's the six-pack muscle, the muscle that runs up and down. But unfortunately that does not provide a majority of stabilization for the core, which is why we always want to make sure that before a patient progresses through the exercise procedures that they make sure they can stabilize their transverse abdominis first and foremost. So Dr. Chang is going to go over exactly how the breathing pattern works and how you can work on stabilizing your transverse abdominis. What I'm going to have you do is go and stick your finger actually in your belly button and take 3 deep breaths in, moving the abdomen in and out. Now as he's breathing, what you're noticing is the abdomen is rising up and down, meaning that ultimately the change in the pressure is causing that to push back out. That's showing us that the transverse abdominis is not stabilizing at this point. What we want him to end up doing is now he's going to show you 3 deep breaths, actually holding the abdomen and actually contracting the transverse abdominis. So go and take 3 breaths in. You'll notice there's not the same amount of movement that he's getting in there because he's contracting that transverse abdominis to help stabilize that area. This is what is important when it comes down to doing the exercises because this is the very basic foundation we'll use as we progress you through these protocols. So if you're wondering how it feels to contract your transverse abdominis, what you want to do is similar to the people you see out at the beach or the gym who are sucking in their guts. What they're contracting is the transverse abdominis. So go ahead and take your finger, draw on the belly button, and see how it feels right there, and go through 3 deep breaths, making sure you don't see any movement of the stomach out and back. That's showing that you're contracting the transverse abdominis, and then you're ready to progress to the next steps of the exercise protocols here.